the new year's coming, a new beginnings, right? Like people think of new beginnings. So I think that's a great thing to look forward to. Something starting a new beginning or something fresh or making goals for yourself for the next year and having measurable outcomes that you can come up with. Like it's overwhelming right now because so many people are trying to get into this space and there are many people out there who just are trying to sell snake oil and it's like the next greatest thing, this new supplement that's going to cure cancer, this thing and there are so many fantastic holistic medicines, plant medicines, nutrition itself. I mean, that's the number one thing. Whatever you put in your mouth is going to determine your health, really. Like it's what a lot of what we eat. We know that. But also just people are out there trying to just make money. And unfortunately, our clients suffer. People who like see these ads or they think this thing's the next greatest thing and it's like going to fix them. But many times, there are many things that are tools they could use, but they have to it takes the whole body. It takes, like, those foundations we talk about all the time, right? Like, those are super important before anything, and the mindset really comes first, That's probably the number one thing, your mindset, because you have to believe you can do something before you can do something. So it's changing that mindset for people. I think that is literally the hardest part. You can give me someone that is 200 pounds overweight, depressed, anxious on a million drugs, hypertensive, cardiac history, erectile dysfunction, no libido, hormones in the gutter, and I could fix them if they want to be fixed. They have to want to, right? They have to believe that they can. And a lot of people, they've got to that point, we have to unravel a lot of stuff because a lot of it is, their history and these patterns of behavior that are just this since childhood. Maybe it's a learned behavior. Maybe it's some coping mechanism that they came up with after experiencing trauma in their childhood. But, I think it's important for us to remember everyone has, like, some of it is worse than other people's, right? But everyone has a history that has affected them, right? In some way, whether in a positive way or a negative way. And if we could humanize that, like if we could, instead of judging others or thinking a certain way about them, if we could just humanize the experience and say, okay, we're all fucked up. Like everyone has their things. And it's like owning it, and that's your authentic self, owning it and then making good of these things, these experiences, rather than taking part in these self-destructive behaviors. I mean, a lot of people, whether it's substance abuse or any types of addictions or things, relationships, things that people do to kind of take away the pain of what they went through, right? And it's important to maybe steer them, help people to realize, we've all gone through things. We have to put that behind you. If we had more people like thinking about life in that way rather than woe is me, thinking about the past all the time, you're not going to be able to move ahead. You have to move ahead. It's time to move on. Everyone has to put on their big girl panties and let's go. It's time. You have to face it. And number one is facing it. So a lot of clients, we come across many people, I mean, that the destruction kind of roots its head as like chronic disease states or not feeling well or being overweight. And a lot of it is due to these lifestyle factors, right? It's not, people say, oh, I inherited the fat gene, or no, you inherited the fat lifestyle. When you're at home and you're living in a house, eating all processed foods your whole life, drinking soda, having this super high sugar intake constantly all the time since you were a baby, being given a soda, a Coca-Cola, Pepsi, when you're a baby, a lot of these people, I mean, look at the parents. It's not necessarily a genetic thing, it's a lifestyle problem. So be that person in your family that breaks that cycle. And let's give health and legacy to our children and our grandchildren in every way that we can, right? Pass down healthy behaviors, break the childhood trauma. Like it's time.
I think what I'm hearing is a lot of people have already tried to better themselves, and because due to the overabundance of content, they are like, this is way too complicated. Now I gotta have a 5 minute meditation. I gotta wake up extra early. I gotta have some turmeric now. What? Already you're like, that is already stressful. I'd rather just get high, and that's that. Boom, solve my problems.
Yeah.
Um,
Yeah.
that's why the whole part of mindset is believing that you can do it, but also not like keeping it super
Simple.
simple.
Most things should be kept simple. I think once we start making things complicated, we muddy the waters in so many ways. Like, it's very simple.
Can hormones be simplified?
Super simplified. Yeah, they're simple. People think that it's so complicated. I mean, listen, treatment of hormones is complicated. I say this all the time because there's people out there trying to treat hormones that haven't gone through trainings. They're not certified. They don't know what they're doing. They think, oh, I'll just give this person a little testosterone. I read it in a book. This is how you do it. They don't understand the intricate workings of how someone is metabolizing a hormone, right? The SHBG, what is SHBG? How, what do they look like? How are they aromatizing this? How are they breaking this down? What are they eating? What is their lifestyle habits? And how is that affecting them hormonally? And then how do you treat them based on that? So many places many providers just kind of give the same dose to everyone of something, for example, testosterone, right? Like, everyone gets the same dose. It doesn't matter if you're 5'5", 115 pounds, or if you're, 6'7", 300 pounds. They're going to give you the same dose. They don't care about your labs. They're just going to do a total testosterone. Now, right, what does that tell us? Nothing. A total testosterone means absolutely nothing. Like, just throw it out the window. Truly. Like, you need way more labs than just a total testosterone to treat testosterone. And I'm not going to give you all my secrets, so I won't go into those labs, but
Right.
know what you're doing.
Yeah, honestly, like, cause that's why alfalfa is so awesome because even from the whole process of injections, it's like you just mentioned it can get very complicated and very gnarly very quickly if you don't know what you're doing in the proper protocols. The whole conversion down to a cellular level, even down to the injection point, timing, like, all that. It's like I'm pretty sure you go over this with your clients.
Oh, for sure. I mean, everyone is well informed. That's important too. Wow. I've heard some nightmare stories of transfer clients. Yeah, absolutely. You really absolutely must explain everything in detail. People don't get it. And if they're not medical, you have to explain it over. Provide them with papers. We send a treatment plan out to our clients so they understand, like, what comes next in the process, right? Go
What's
ahead.
that book you gave me? We'll put it on here, but what is that called again?
Which one? Oh, Normal is Not Optimal. Normal is Not Optimal by Dr. Neil Rouzier. He is one of my mentors and colleagues, and he's literally the grandfather of hormones. He taught most people, he by far is one of the most well versed in hormones in the world, really, truly. And I was lucky enough to learn from him firsthand. So I was taught by him, as were many other providers. He helped so many people, hormone specialists he helped to treat, and using evidence-based medicine. And that's the most important because we're not just making up protocols and just doing what we're doing because someone told us to. It's science. It's literally data. We have data. We follow data. And that's the main thing. We track data and how our clients do. And we check labs frequently and we make sure everyone is kind of hitting the mark. And we want our clients to feel their best, but not just feel their best and look their best. We want to know inside their bodies are working better. They're increasing their longevity, their health outcomes, their markers, their lipid levels, their cardiovascular risk factors. All these numbers are declining while we're treating them. And that, for me, is the best part.
It's like, let's say, like when I see my brother have like 3 Fs, and I'm like, well, you have 1 F now. It's like the whole problem isn't solved, but at least you're not getting kicked out.
It's getting better, right? For your brother.
Yeah,
That's
but I'm
good.
saying, like, in contrast, like when it comes to your hormones, you can see a guy, he's 6'7", he's 300 pounds. Now he's like 280, and it's like his lipids levels, his testosterone's up, that GLP-1 is working. Maybe he's due to overweight, his ankles are messed up. Now he's got ankle issues, so you give him that BBC, that Wolverine stack. It's like,
And he feels better and he's able to work out and now he's losing weight and he's not insulin resistant. Yeah, I mean, baby steps, right? I think there are many people that come to us and they're overwhelmed because they're not used to people spending so much time and caring about them. I think that's one of the things that floors me because when I was young, like, I would go to a pediatrician and the doctor would be with me and my parents for like half an hour long, like 45 minutes explaining like wellness, childhood wellness. Now, forget it. Your kids are lucky if they get 10 minutes with the provider at the pediatrician, if using an insurance based medicine, traditional medicine. And it's sad because people lose that personalized touch. And really, how much can you get to know about someone in 10 or 15 minutes? Not much, right? I mean, we know everything about our clients, like whose parent just passed away, who's getting married, whose child is, going through a divorce and they have to be there to help with their grandkids. Like, we know everything about our clients. They're retiring, like, they're moving, everything they go through, we do it with them. We help them prepare for these things. So, we have one client, he is a triathlete. He's an Ironman. He's done so many Ironmen. He's middle-aged gentleman. I mean, he's great. He's thriving. I don't even know. I don't even know how many Ironmen he did last year alone, but he's been our client for a few years and he's doing great. He's thriving. He's doing amazing things. And, every time like a race is coming up, okay, we're gonna switch this, we're gonna change this around. Okay, hydration and micronutrient support for your races, for your training bricks. We work together as a team. So it's not just us dictating, this is what you need to do, Kevin. Right. You have to do this because I said so. It's a total different way. We really work in conjunction and collaboration with our clients and we figure out what works best for them. So it's great. I love what we do. I'm absolutely blessed. I have the best team of people working with me. And really, I don't feel like we're just a team. I don't think we would function the way we do without one person. We all work so well together and we all play an absolute integral role in Alpha Health. So Patty, Emily, everyone plays a big role in what we do and what we stand for, and everyone lives by our core values. And that's our number one. We get along, but it's my number one rule, and it's the one thing I will never hire anyone unless they live by our core values. So you have to live the lifestyle. Like you need to believe in what we stand for and live that lifestyle. So taking care of yourself, others, empathy, compassion. Who's going to go to a trainer that's not living a healthy lifestyle to help them get in shape? Who's going to go to a doctor? I mean, I laugh when I say this because I worked in the emergency department for many years and so I saw many different physicians and providers coming in and out throughout the days. And some of them, you're just like, how are you promoting health? When you look at them, they're just a heart attack waiting to happen. I'm sorry, but I said it. It's true. You know, I love what we do.
Those are the facts.
Those are the facts.
Do have the question. I will play devil's advocate real quick because that same fat doctor will say, "But I went to Harvard. I went to the best school. I know the information back and forth."
Right. So you're absolutely right. There may be people who have the brains and know what to do, but they're not doing it themselves. So maybe he can, this doctor that may not be healthy and say he knows how to keep people healthy, but he chooses not to. How many people would trust someone who says, I know how to make you live for a long time, but they have 5 stents in their heart because they've been smoking and eating, just living an unhealthy lifestyle for so long? How many would you trust that person? I mean, you're not building trust, right? It just, you may be able to do it, but if you're not following it, how can you have people follow you? To be a good leader, you have to be part of the team and like help lead side by side. It's like telling your children, do as I say, not as I do. Guess what? They're not going to end up doing what you say. They're going to do what they've seen you do for the last 18 years of their life. That's what they're going to do. Your kids learn by observing you. They learn healthy habits by observing you. They learn unhealthy habits by observing you. Unhealthy habits, addictions, food patterns, anything. The way you communicate with your partner, like your kids learn that. So the same thing goes for your patients, your clients. Like you have to be the model. You have to model, be the model, show them what can be done and help them because it's not about us, it's about them. and helping them to see and find their own light within them. Those are the facts.